Why do wounds heal more slowly in people with diabetes? Is it simply because there is too much sugar in the blood? The real answer is more complicated. Wound healing depends on blood flow, immune cells, nerves, and the body's ability to build new tissue, and diabetes can affect all of these processes. When the skin is injured, the body immediately begins trying to stop the bleeding. Blood vessels constrict, platelets gather at the injured area, and a clot forms to protect the wound. Next comes the body's defense response. White blood cells move toward the wound to fight bacteria and remove damaged tissue. This creates the foundation for the next stage of healing. But when blood glucose remains high for a long period, the small blood vessels that supply the skin and surrounding tissue can be damaged. Reduced circulation can mean less oxygen, fewer nutrients, and fewer healing resources reaching the injured area. Diabetes can also affect the nerves. When sensation is reduced, a person may not notice a small cut, blister, or pressure injury quickly. Continued pressure or repeated irritation can then make the wound harder to heal. Now look closer at the wound itself. To rebuild damaged skin, the body needs specialized cells to produce collagen and other structural proteins. Diabetes-related metabolic changes can interfere with several parts of this repair process, making the formation of healthy new tissue less efficient. The immune response can also be affected. Persistently elevated blood glucose can impair some immune functions, making it harder for the body to respond effectively to bacteria and other threats. If an infection develops, the healing process can become even more difficult because the body now has to fight the infection while also rebuilding damaged tissue. So, slow wound healing in diabetes is not simply a matter of having sweet blood. Blood circulation, nerve function, immune defenses, and the body's ability to rebuild tissue all play important roles. This is especially important when a wound appears on the feet. A small injury can sometimes go unnoticed because of reduced sensation, while poor circulation and impaired healing can allow the problem to become more serious. If someone with diabetes has a wound that is not improving, becomes increasingly red, swollen, warm, painful, or produces pus, medical attention is important. So, why do wounds sometimes heal slowly in diabetes? Because prolonged high blood glucose can affect blood vessels, nerves, immune defenses, and the body's ability to rebuild tissue, turning what should be a simple repair process into a much slower one.